A Chicago woman in her 60s was the first Illinois resident to die from the new coronavirus, and the state's largest outbreak at a single location has taken hold at a West Suburban long-term care facility where 22 people are now infected, state officials said Tuesday.
Patricia Friesen, 61, of the Gresham neighborhood on the South Side, was diagnosed with COVID-19 and died Monday night at the University of Chicago Medical Center, according to the Cook County Medical Examiner's Office and one of her siblings.
At his daily news briefing, Gov. J.B. Pritzker said he was deeply saddened to share news that I've dreaded since the earliest days of this outbreak.
I want to extend my deepest condolences to her family members, Pritzker said. I want them to know that the entire state mourns with them.
Friesen, a retired nurse, began experiencing difficulty breathing last week and went to the emergency room, said her younger brother Richard Friesen, who lives in Minneapolis.
Friesen, who had a history of health problems including respiratory issues and pneumonia, wasn't too concerned when she first checked into the hospital, her brother said. But her family became nervous as they learned more about the coronavirus and her condition deteriorated.
The family doesn't know how she came into contact with COVID-19, Friesen's brother said.
She doesn't have high mobility, so however she got it, it was brought to her, said Richard Friesen. The only thing she gets out for is funerals. She got out for a funeral a couple weeks ago. She doesn't really get out of the house much other than to go to church.
Patricia, one of 9 children, loved to sing solos at church, where she didn't shy away from the spotlight, her brother said. She loved doting on her nieces and nephews, and was one of the sweetest people you ever want to meet.
Though some family members wanted to get tested for COVID-19 after Patricia's diagnosis, they've had trouble, Richard Friesen said. 2 sisters, one of whom has been hospitalized with respiratory problems, have not been able to get tested, he said. Another brother was tested and is in self-quarantine as he awaits the results.
We just need testing. The biggest issue is that there is just no testing going on, Richard Friesen said. No one knows for sure what's going on, and people are walking around with a cough and, it's just ridiculous. It's ridiculous that you can't get a test.
55 new cases of COVID-19 brought the total in the state to 160, across 15 counties. The patients, at least 4 of whom have recovered and are no longer in isolation, have ranged in age from 9 to 91.
The somber announcements of the state's first coronavirus death and the uptick in infections came a day after Pritzker announced the cancellation of all gatherings of 50 people or more, and followed the opening of the polls Tuesday morning to paltry turnout.
Among the new cases were 17 patients and 4 staff members at Chateau Nursing and Rehab Center in Willowbrook. This is the same facility where a woman in her 60s was identified Saturday as having the virus, and was hospitalized in stable condition, in a case believed to have been transmitted through the community.
Officials previously said they were trying to contact all people who had contact with the woman, including staff and visitors, which is standard procedure for tracing people exposed to the disease.
Residents at the facility are being screened aggressively, and those who've been diagnosed have been isolated at the home or in the hospital, said Dr. Ngozi Ezeki, director of the Illinois Department of Public Health. Staff who've tested positive are furloughed at home.
Illinois officials are trying to learn from the experiences of Washington state, which as of Tuesday afternoon had 29 deaths associated with a single nursing home.
On Tuesday, DuPage County Board Chairman Dan Cronin, who declared a disaster in the county, issued a statement calling news of the cluster deeply upsetting.
Of course, we are deeply troubled by the news of the increase in cases in DuPage County, Cronin stated. We are praying for all of those who are ill. But there's more we can do. We must intensify our efforts to adhere to the public health guidelines and ask every person to take every individual action they can, social distancing, hand washing, covering sneezes and coughs to protect others.
As is not unusual in the nursing home industry, Chateau Nursing was cited previously for health violations. In 2018, the Illinois Department of Public Health fined the nursing home $2,200 for safety violations after 2 residents were left unattended, and fell and hurt themselves, despite being known to be in danger of falling.
Officials from the nursing home did not immediately return calls for comment.
Officials from DuPage County, the State Department of Public Health and U.S. Centers for Disease Control and Prevention were working to identify anyone who may have come in contact with the newly infected patients, County Health spokesman Don Bolger said.
The average person may have had 50 to 90 contacts, resulting in up to nearly 2,000 potential exposures, Bolger said. Nursing home patients may have far fewer contacts, Bolger said, but the only way to know is by tracking them down.
Key, director of the Illinois Department of Public Health, said measures to limit the spread are crucial to protecting those most at risk from the virus, people over 60 and those with underlying health conditions, and the health care workers who care for residents in nursing homes and patients in hospitals.
This reinforces the need for all of us to do our part to reduce possible exposure in the community to those who go in and out of these facilities as they provide care to these residents, Key said.
She added, it will take all of us making intense sacrifices to reduce the spread of the virus and free up our health care system to care for those who need it most.
As the number of COVID-19 cases across Illinois continues to spike, Dr. Allison Arwady, commissioner of the Chicago Department of Public Health, said it's important to remember that some of the increase can be attributed to the increasing availability of testing. The aggressive containment measures that we've been talking about and that all of you have been taking will not show up in the numbers today or tomorrow or in the very short term, Arwady said. These measures that we've taken are about bending the curve over the long term. On Tuesday, cases started to surface with ties to local universities, fire departments and Midway Airport. Northwestern University reported 3 confirmed cases at the Evanston campus. At the University of Illinois at Chicago's College of Medicine, university officials said a graduate medical trainee tested positive. City officials said a Chicago Fire Department paramedic tested positive for COVID-19. A source told the Tribune the firefighter was assigned to Ambulance 38, located in the Hyde Park neighborhood. He did not contract the virus through employment, but continued to work after exposure and stopped working upon testing positive, according to a source. In Highland Park, 3 paramedics are under quarantine after caring for a person who may have been exposed to the virus, city officials said. And at Midway, 3 workers at the Air Traffic Control Tower tested positive for the virus. The Air Traffic Control Tower temporarily closed Tuesday, slowing operations, according to the Federal Aviation Administration. In other parts of the city, daily life further unhinged from normalcy, as students paged through packets or transitioned to e-learning on the first day of the Illinois schools shutdown. Added to the ever-growing list of cancellations were public meetings, police training and commencements. Wednesday's city council meeting was canceled. Additionally, Mayor Lori Lightfoot announced non-essential city workers will be allowed to work from home. Those excluded include Chicago Police, Fire, and Office of Emergency Management and Communications personnel, as well as people working in streets and sanitation, the airports and water departments. Lightfoot also said the city is working on a local package to support hourly workers that will be released in the next couple of days. At a crucial time for a department that has fallen under a federally mandated consent decree to improve training and other policies for its 13,000-plus officers, the Chicago Police Department canceled all training at its police academy, according to a police memo obtained by the Tribune. With fewer places open to the public and growing numbers of commuters working from home, crowds dipped on public transit. But on a day normally filled with festive pops of green and pubs filled to the brim, Chicagoans still went out for Irish whiskey. Binny's Beverage Depot, a 72-year-old, family-owned Chicago liquor retailer with 42 Illinois locations, is well-stocked and moving a lot of Jameson and Bushmills in the wake of Pritzker's order closing all bars through March 30. In terms of business, it's not like a grocery store where we're running out of toilet paper, said Binny's spokesman Greg Versch. But we are seeing all the St. Patrick's Day classics selling well. Metra said that on Friday it carried only half the number of passengers it normally has on a typical Friday. On Tuesday, the commuter railroad said that it would continue to operate its regular weekday schedule at least until Friday. But it is prepared to switch to a modified schedule, and any change would be announced well in advance.
On the CTA, ridership between Wednesday and Friday of last week was down 12% from comparable periods before the outbreak, with a drop of 19% on rail and 6% on buses, said spokesman Brian Steele. CTA ridership numbers were expected to further drop Tuesday, with the shutdown of Chicago public schools.
New York City Mayor Bill de Blasio on Tuesday told residents to prepare for the possibility of an order to shelter in place within days, and the Federal Centers for Disease Control and Prevention is recommending gatherings be capped at 10. Pritzker said he's continuing to consult with medical doctors and scientists about further measures in Illinois.
We're going to continue to evaluate that every day and consider what options we may need to take going forward, he said.
In what has become a daily refrain during the outbreak, Pritzker kept up his criticism of the federal government for the pace of getting testing materials and other equipment to the states to combat the virus.
This is an incredible failure by the federal government, and every day that they continue to abdicate their responsibilities is another day that we fall behind, he said. I've requested and now I'm demanding that the White House, the Food and Drug Administration, and the CDC produce a rapid increase in test deployment nationwide, or get out of the way and allow us to obtain them elsewhere ourselves.
At the same time, Pritzker is looking to Washington to provide aid to businesses that are being hurt by closures and other fallout from concerns over the new coronavirus.
The coronavirus pandemic has sickened more than 185,000 people around the world, according to the Associated Press. More than 7,300 have died, about half of them outside mainland China.
In the United States, at least 4,500 people have been infected with the virus, and at least 88 have died. As of Tuesday, according to Johns Hopkins data, the number of reported cases was up about 900 over the past 24 hours.
Chicago Tribune's Gregory Pratt, John Byrne, Jeremy Gorner, Paige Fry, Catherine Rosenberg Douglas, Lauren Zumbik, Robert Chanik and Mary Wisniewski contributed.